We talked a little bit before about tools to assess patients when they're not in the infusion center. So Rebecca, can you tell us about some of the tools that are out there that we can use and that our audience can potentially
Absolutely.
access?
So there are several good tools. Probably one of the first tools was the Functional Living Index Emesis questionnaire that was developed by Celeste Lindley many, many years ago. And it's a quality of life validated tool that initially looked at patients and followed them for 3 days after chemotherapy, and then later they developed a 5-day tool. I think this tool, by and large, has been attached to clinical trials, more so than being actually given to patients to use at home. I would like to just say that the mask anti-emesis tool is probably a little easier for giving to patients and explaining to patients. Then it's a tool that they can use at home to keep track of the episodes and the degree of nausea and vomiting, not only during the initial 24 hours, but in the subsequent days during that delayed period. It's an opportunity for them to provide feedback to the nurses and the physicians and the pharmacists so that we can see how well they're doing and to make changes to their treatment plan if necessary. It's a tool.
How simple is that to use, the mask tool?
It's very simple. It asks a question, how much vomiting did you have, and asks you to actually write the number, and then there's a visual analog scale for the nausea component. 0 being not at all, and then 10 as bad as it can be, just simply putting a mark on the line to talk about how much nausea they've had. And then, patients can bring that back to the clinic with them for their next visit, or the nurse can call and find out. They're also, this is available as an app, so that patients can have it on their smartphone or iPhone, and that information can be transferred to the physician or healthcare professional in real time, so that we can really have that information right away.
That's a great use of technology.
Yeah.
I found our patients actually are much more comfortable with the apps than they are writing on paper.
Yeah. Yeah.
And they're just much more willing to use that. And it is invaluable information when you're planning on chemotherapy. At least from the pharmacist perspective, when we're getting things ready, checking labs, it's almost another lab that we're checking, how well you tolerated your last cycle of chemotherapy.
And for those institutions that don't use the app, logs or diaries are absolutely perfect to use as well.
The added benefit, too, of the mask anti-emesis tool is the 24-hour validation. So you can kind of get those 24-hour intervals rather than the 3- and 5-day recall.
Right.
And I find when I talk to a lot of folks that are interested in this topic and find it to be a priority that they're capturing this data, but not necessarily with these validated tools, for fear that the tools are so just complex and take a long time. But the mask anti-emesis tool is very short and easy to do. And if you're going to capture that data, it's nice to be able to compare your local data with what's happening in the studies.
If I could just add one more point, it's available in multiple translations, I believe 13. So we all live in a country that have patients that have come from many other countries, so it's very easy, and it's wonderful to have this available in the language that they can relate to.
So I'm hearing that monitoring patients using a simple tool like the mask tool is really valuable, and you could and it's simple, and
Very
patients
simple.
can communicate, and we really need to do more of that.
Yes.
Great.